Now, sexual dysfunction is a condition that is perhaps not so well understood, but it affects a large number of people. So today in our female health feature, Dr. Mark and Sister Elise will be shedding some more light on this topic. Welcome, good to have you both back with us.
Thank you, Michael.
Elise, let's start with you. I mean, briefly, what is sexual dysfunction? I mean, are we talking about something, or are we talking about a series of things?
Okay, I think I want to start with when we talk about sexual dysfunction, the first thing people think is women that was abused as a child or raped or stuff like that. Sexual dysfunction that we deal with is women is presenting with certain symptoms. One of the first things is avoidance of intimacy, maybe some physical changes. I think I want to hand over to him.
So we're talking both psychological and physical things.
Yeah. If we talk about sexual dysfunction, I think we need to understand that sexual dysfunction can be because of physical attributes or lack thereof, emotional conditions, medical conditions, etc., social conditions, economic conditions.
Okay.
I think let's focus on the ones that most women would start dealing with. That's pain, infection, incontinence would be classified as a sexual dysfunction because this will lead to avoidance, as Elise has said.
Yes.
I think it's very important that we understand that during different periods of our lives, there's different conditions that would be the major contributor to sexual dysfunction. I think if we look at our early 20s to mid-30s, these would be things like abuse and anorgasmia. Anorgasmia can be related to that learning process of female sexuality that didn't take place.
Just clarify for the viewers, anorgasmia?
An inability to achieve an orgasm. Now, this can be an inability to achieve an orgasm through penetration, or even more severe when you're unable to achieve an orgasm through direct stimulation of the clitoris. As we move on, the biggest contributing factor to sexual dysfunction in women between the age of 40 and 55 is actually sexual dysfunction in their partners. Okay. And here we're looking at erectile dysfunction, etc., etc. Yeah. Your partner, men who are battling with erectile functioning or failed erections, start becoming anxious and embarrassed, and that leads to avoidance. What women then experience is the psychological side effect of, I'm not attractive anymore, I'm not turning my partner on, or suspicion, if he's not finding gratification with me, where's he finding it? And that leads to a psychological sexual dysfunction.
Okay.
I want to touch on the physical sexual dysfunction as well, or physiological sexual dysfunction. That age group are all on
antidepressants,
contraceptives, etc. And what we found in our practice is that that also has side effects.
Okay.
So the woman loses interest in the sexual act because of the contraceptives that she's taking. And then she has this avoidance thoughts of, oh, tonight is that night again, and I want to.
It becomes a duty.
Do something.
Yes.
Becomes a total duty. So that's also classified as sexual dysfunction.
So in a nutshell, if I can say, when we talk sexual dysfunction, it's really anything that causes or prevents somebody from engaging in sexual intercourse, whether it be as you say, an infection, a mental issue, a challenge, a physical discomfort, emotional discomfort, anything like that.
Yeah.
So we look at, for instance, in a young group, our patients who are still in their reproductive years. Things like endometriosis would lead to pain during intercourse, and that could lead to a sexual dysfunction. This is not nice for me. It's actually painful. We look at other conditions, for instance, lichen sclerosis, where we have these plaques that form. Infections, yeast infections, can lead to a burning and itching irritation. As we get older and we go into our menopausal years, there's a decrease in lubrication, which makes it uncomfortable to have intercourse, especially for people who do not use some kind of artificial lubrication. We look at medical conditions, depression, anxiety, that would lead to a downregulation in libido and sex drive. The medicine that's prescribed for that would lead to problems. So, there's a spectrum. Anything that prevents you from enjoying the actual act of physical contact and sex. And I think we should differentiate between intercourse and sex, because not wanting to have sex is sexual dysfunction. Okay. Never mind not wanting intercourse because it's painful.
Right. So I think at this point we can almost split this into like two categories, where you've got your physical, physiological, and then you've got your psychological. Now, your physiological and your physical, Elise, you can hand over to Mark if you need to, but I just want to find out, is this something that is caused by a poor lifestyle? Its aging is implicated in this. What are the factors that would then influence the physiological dysfunction in sex?
That's very interesting and is so broad. I don't know where to start to answer that. For instance, say a woman gave normal birth. Physically, there is discomfort in the vagina because of maybe she had an episiotomy and there is nerve damage or something like that, or a fibrous tissue formed there, or some, that's some of the physical stuff that I'm thinking. Endometriosis, like what Dr. Mark mentioned, is something that was said, and these studies that proved it, that the high stress lifestyle that women live nowadays, they are more prone to endometriosis, for instance. Okay. There's so many different things that can create physical sexual dysfunction.
Right.
Stress incontinence, we spoke about urinary incontinence, but the most pervasive form of incontinence is stress urinary incontinence in that age group, and that's usually after giving birth or having pregnancies, etc., etc. Right. Can be genetic as well. Okay. Psychological, I think, as I said, also stressful lifestyle, 4 babies hanging on to your pants in the evening when you get home after a stressful job. I think that is where the psychological, emotional part also can come in. Right. Stressful relationships, for instance.
Yeah.
It was so interesting, actually disturbing. In one of the previous seasons, Michael, we spoke about the fact that 60% of women at some point in their lives, I think the actual figure was 56% of women, at some point in their life would be the victim or survivor of sexual abuse. So when we talk about psychological things, it's not only abuse, but the way that we were brought up for such a long period of time, and I think still today in certain religious beliefs and cultural belief systems, sex is seen as something that's for procreation only and a man's right or privilege. Instead of bringing women up in the sense that sex is something there to be enjoyed in the way that you like it.
Yes.
For your own benefit, whether it being stress relief, etc., etc. And that would lead to a sexual dysfunction. Cultural beliefs could be one of the major contributing factors of sexual dysfunction in women.
How can we make it easier for people to embrace the idea that it's okay to talk about sexual dysfunction, and there's help out there, and it's not a bad thing if you're experiencing it, because you're one of many?
Just accept it's a problem, as you will accept that I broke my toe, now I need to go to a doctor. That's what I think. I often get women in my office where when I broach the subject, they start giggling because it's not a normal topic to talk about.
I think it's so difficult to get to the point where you can openly discuss this with your practitioner. Some of our practitioners have certain cultural beliefs and their own belief systems where discussing this is uncomfortable for them. Not only it's uncomfortable for the patient. Again, being involved in your own health, finding the person that will listen to you, not judge,
Yes.
help and advise without preconceived ideas. It's quite difficult. In the work that we do, not only in our clinic but on our media, we speak about this. We've spoken about at length a woman's journey to orgasm, which is a learned process. So this comes with education, practice. You need to practice how to have an orgasm. Unlike men, for us, that's what we do, is we have an orgasm. Women, it's completely different. The evolution has changed. We no longer have to have an orgasm to ovulate. We now ovulate automatically. So there's that stigma around sexuality, which I think is starting to change. It's about getting the right information. For people that are going onto the internet. What we see there is not the reality.
And I think that's why it's so important to be having these kind of discussions, because it gives us an opportunity to put out information that's legitimate. And I mean, Google is a wonderful thing, but it can also be quite risky too. So thank you for coming to share some more. But in the meantime, Mark, if somebody wants to get hold of you guys, where can they find you?
www.tclinic.com, or the telephone number in Johannesburg, 010-824-1393.
Wonderful. As always, thank you so much for joining us.
Thank you.